about 40, 45 would be normal. Any higher than that would be E prime velocity would be lower than 6, 7 centimeter per second. So that this is animation then can show you, we can tell that relaxation by the echocardiography. This is just animation showing the contraction and relaxation filaments of the myocytes. And when calcium enters the cell and binding to the troponin C there, and that's when contraction starts, right? And then relaxation is really that happens upon the release of the calcium. Its actions really precisely controlled to milliseconds, and it happens every cardiac cycles. And we can look at that from apical four-chamber view. Show you. Equal to apical four-chamber view. This is a little Mayo format, but it doesn't really matter that the annulus moves really vigorously from apex to the base and fill the ventricle, sucks flow into the ventricle here. And the individuals with the bad relaxation does not have much of movement, so only it's a lateral motion here. And then we can do tissue Doppler of that. Place a sample volume at the medial or lateral annulus. And then in the Mayo laboratory, we do mainly medial for clinical purposes. And then normal individuals has more than 10 centimeters per second. And then patients or individuals with the myocardial dysfunction, any forms of cardiomyopathies will be less than 6, 7 centimeters per second, usually 4 or 5, as you see here. So, okay? So you can really separate myocardial disease from normal diastolic function just looking at tissue Doppler. So I think tissue Doppler is really the most important things we do echocardiography-wise, whether this person has a diastolic dysfunction or not. That's sort of screening tool.